Can you start out by providing with a summary of each of the major medication categories for ADHD and how they differ in their effect?
Well, we have basically the stimulants and the non-stimulants. The stimulants are divided into two classes, the methylphenidate class and the amphetamine class. There is a preferential response within this class with individuals where a third will have a preferential response to methylphenidate, which is commonly known as Ritalin, Concerta, Bifenton, or Foquest. And another third will have a preferential response to the amphetamine base class, and that is dexedrine, Vyvanse, Adderall in that class. And another third will respond to both classes. And so whatever we prescribe in ADHD from the very beginning, and we always start low and go slow with our medications, we'll have about a 65–70% chance of getting it right out of the gate. If you don't, then you switch class. And then we generally go with the psychostimulants to begin with because they're the ones that have the most efficacy. The effect size of a stimulant is anywhere around between 0.9 and 1.1, and that is actually huge when we treat any condition with medication. For example, the effect size with an antidepressant for a mood or anxiety disorder is around 0.5. So that gives you some perspective as to how effective these medications are. In the non-stimulant class, we have atomoxetine and guanfacine SR, which is XR, which is intuitive. And the effect size of atomoxetine or Strattera is around 0.5 to 0.6, and guanfacine XR is probably around 0.5 to, let's say 0.5. So clearly, the psychostimulants are the drugs of choice to begin with. We also have other medications such as Bupropion, which is an antidepressant, which has a mild effect size response for ADHD. You might be looking at an effect size of 0.3 to 0.4, but clearly we want to give everybody, providing there's not a contraindication, a chance to have a trial of stimulant therapy. So when the nice thing about the psychostimulants is that they do not bioaccumulate, meaning that once we give the medication for its duration of action, they're formulated to have an effectiveness over, let's say, from anywhere from 4 to 16 hours during the day, the way many of them are formulated. And once they've finished working, they basically are cleared from the system, whereas atomoxetine, guanfacine, etc., do bioaccumulate. So the nice thing about a psychostimulant is that if you're having a side effect, they tend to resolve fairly quickly. So in the methylphenidate class, for example, we have medications that can be sprinkled or dissolved or swallowed. For example, with Bifenton, Foquest, we can sprinkle those medications. The other two big drugs in that class are Ritalin and Concerta, and all those medications are released differently in terms of in the first 4 hours, you may get anywhere from 50% to 18% release, depending on the choice of medication that you make. In the amphetamine class, we have Vyvanse that can be chewed, dissolved in water. Dexedrine can be, the Spansil can be sprinkled. So in terms of, a lot of kids can't swallow pills. So we have to look at strategies that will employ dissolving, sprinkling, or chewing.